Welcome to Preventing Falls and Injury from Falls, Understanding Your Role in the Prevention of Falls and Falls with Injury, a Frontline Forces training presented by Superior Health Quality Alliance, or Superior Health. The information contained in this module is relevant for nursing assistants who are on the front lines of providing care for residents, anyone providing care to an older adult in any caregiving capacity, and even those not in a caregiving capacity who are looking for ways to improve their knowledge and understanding the role they have in preventing falls and falls with injury. Superior Health aims to empower you by increasing your confidence with making the right decisions, knowing when to tell someone what you see, and the ability to prevent falls and falls with injury. The purpose of this course is to further your learning and application of these skills to real-life situations. What you do can improve the quality and safety of older adults in your care. The learning modules, Preventing Falls and Injury from Falls, is a three-part series. You are viewing the third of the series, Understanding Your Role in the Prevention of Falls and Falls with Injury, which provides an overview of how to identify steps to reduce falls and recognize barriers to preventing falls. This module has two additional sections in the series. The first provides an overview of the significance of falls and falls with injury, and the second provides an overview of risk factors that can lead to falls and falls with injury. It is not necessary to complete the entire series in one sitting. You can leave and return to the course at any time. After completing this module, you will be able to identify steps that can be taken to reduce a person's chance of falling, recognize barriers to preventing falls, select proven ways to reduce and prevent falls, and demonstrate ways nursing assistants and licensed nurses can work as a team together to prevent falls. Falls and injury from falls can have a significant impact on the quality of life of older adults. It is important to be aware of the existing risks people you care for are experiencing and what you can do to ease and relieve those risks. Let's take a look at Herman. Herman is an 84-year-old man who has been living in a nursing home with his wife for the last 2 years. Herman has moderate dementia. His blood pressure falls when he stands up too fast, which makes him feel dizzy. Recently, his wife passed away, and since that time, Herman has been more depressed and has difficulty sleeping. 2 years ago, Herman used a walker to get around, but now he mostly uses a wheelchair. He also is less able to complete his toileting, bathing, and grooming on his own. Over the past several months, he has become less aware in his surroundings and has experienced loss of balance, resulting in many falls, most of them happening over the nighttime hours. As you listen to this learning module on the significance of falls and falls with injury, keep Herman in mind, as well as his risk factors for falling: moderate dementia, blood pressure falling, feeling dizzy with standing, feeling more depressed, difficulty sleeping, decline in mobility, increased use of assistive devices such as a wheelchair, becoming more dependent with toileting and personal care, impaired awareness, and his history of falls. As his nursing assistant, what is your role in helping to protect him from having an injury from a fall, and especially when he is at most risk during the night? You, as someone who cares for older adults, can play a pivotal role in their safety by becoming aware of the risk factors that lead to falls and what you can do to reduce the severity or even the occurrence of a fall. Falls don't have to be inevitable. Steps can be taken to reduce their chance of falling or preventing falls. There are proven ways to reduce and prevent falls, even for older adults, that we will review throughout this learning module. You want to prevent falls and falls with injury without limiting mobility and independence. This can be challenging, but this can be done. First, be aware of your own surroundings and what threats people you provide care for are at risk for. Be responsive. Don't hesitate and take action. If you see an accident waiting to happen, fix it and report it. Involve, engage, and support others on your team. Sometimes you cannot do it alone. When this is the case, work with your coworkers to develop a plan. Communicate. Learn from others by talking with them and others on your team. Support your team members. Do not place blame. Be a good team member and expect good teamwork from your team members. Although some of these things may not be under your control, as well as other strategies discussed in this module, it is important to be aware of the possible strategies that can reduce risk of falls and falls with injury. A range of strength and balance training interventions also exist to prevent falls. Studies show exercise consisting of gait, balance, and functional training, strengthening exercises, and flexibility are the most effective interventions. Look around at your environment. Fall prevention can start with making improvements in the environment to fit each resident. This is usually determined in the care plan after it has been reviewed by the multidisciplinary team. This is an important step that can effectively reduce the number of falls and fallers. Here are some examples of modifications that can be made in the environment. In persons with dementia, contrasting colors for doorways, phones, water jugs, wheelchair arm pads, toilet seats, and call lights can make a difference for those individuals. Additional strategies include strong lighting, night lights, and lighted pathways to the toilet. These are good practice and in place at many facilities. Individualized and person-centered care approaches emphasize residents' unique characteristics. One approach does not fit all. Some examples of tailoring interventions to fit the person include lowering the bed or using a floor mat. Other individualized approaches include removing room clutter, remove any physical hazards or anything in the person's way that could cause the person to trip, such as rugs, pads, or other floor coverings. This may also include wiping up a spill on the floor after giving personal cares or eating. Equipment, such as a walker or wheelchair, can be moved so it is not a tripping hazard, yet still accessible if the person is independent and able to be up on his or her own. Making sure shoes or other approved footwear are readily available and sufficient lighting, as mentioned earlier, may also be appropriate to consider. Implementing a toileting schedule that may be more frequent is a great customized approach to consider. And another is consciously selecting room location. Medication side effects are some of the most important risk factors to be aware of when caring for older adults. Medication side effects that may increase one's risk for a fall include medication-induced delirium or other change in mental status, medication-induced bowel or urinary frequency, medication-induced hypoglycemia or low blood sugar episodes, or medication-induced syncope or fainting. Some things to consider to manage risks for falling from medication side effects include customize a scheduled toileting program up to every hour. Cognitively impaired patients may not be able to control their urge to use the toilet or ask for help. Also, time the toileting assistance so they are toileted before pain medications. If an older adult feels faint or blood pressure is low when standing up, allow the resident time to sit for a period while the gait belt is applied or before he or she rises to a standing position. Take every opportunity to put eyes on the patient. When you walk past a room, look to see, are there feet in the bed? Is the room clutter and trip-free? Be aware, be responsive, be part of the team. Other strategies that have been shown to reduce the risk of falls include having a consistent assignment of staff to the same residents, completing charting near the rooms of residents identified as having frequent falls, increasing staff availability to cover the change of shift and during high-risk times of day, such as the hour just before meals and during sundowning, and having a nursing assistant shift change report to be informed about existing risks for those in your care. Have you ever had a person lose balance while you were assisting with toileting? Did you feel like you had the right skills to manage the situation? Did you feel like the environment was safe? Sometimes there are risk factors in the environment around you. A room or bathroom design problem, lack of space, obstacles in your way, equipment malfunction, or the equipment not available when you need it. Falls can result in injuries to the patient, resident, staff, and family who are assisting. The more risk factors a person has, the greater their chances are of falling. Being aware of risk factors can prevent falls. It takes teamwork. Fall prevention requires you and everyone on your team to be active in recognizing and keeping those risk factors that can be under control. It is now time to test your knowledge. Click the link for Understanding Your Role in the Prevention of Falls and Falls with Injury quiz on the Frontline Forces webpage or in the YouTube description below.